with an announcement. If Martin, you want to read the announcement, and then we'll have introductions.
Yes, Mr. Chair. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. This meeting is also being recorded for the minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you very much.
Thank you. And at this time, will you call the roll?
Yes, Mr. Chair. Sean King, Chair.
Present.
Thank you. Deb Poland.
Present.
Thank you. Sheldon Taubman.
Present.
Thank you. Giselle Carlotta McDonald. Leslie Greer. And Jared O'Sullivan, subject matter expert.
Present.
Thank you.
All right, thank you. And welcome committee members. At this time, can we have our colleagues from Access Health also introduce themselves?
Yes, good morning. My name is Tammy Hendricks. I'm the Director of Health Equity and Outreach here at Access Health Connecticut.
Good morning. I'm Holly Zwick, Director of Finance, Access Health Connecticut.
Good morning, Susan Rich-By, Director of Legal and Governmental Affairs at Access Health Connecticut.
Good morning all, James Michelle, Access Health Connecticut. My apologies for my tardiness.
You're right on time, James.
Thank you.
Any others want to introduce themselves? Okay. One thing before we move to public comment, I just want to circle back during roll call. It was noted Giselle Carlotta McDonald was not present today. It's my understanding she is stepping down from this committee, and there will be somebody nominated by the board to replace her, and we'll look forward to having our new colleague at another meeting in the near future. But in the meantime, just want to thank Giselle for her service and the time that she spent on this committee.
Yeah, thank you.
And Mr. Chair, I believe Ms. Holly Hackett also stepped down from the committee.
Oh, okay. So Holly Hackett, and also thank her for her service as well. Next is public comment. Martin, I understand there was no public comment submitted.
That's correct, Mr. Chair. We didn't receive any public comments.
So moving on to the next item on our agenda is a review and approval of the minutes of the August 6th, 2024 meeting. I will entertain a motion to approve those minutes.
So moved, Deb Poland.
Moved by Deb. Is there a second? I will go ahead and second then. Is there any discussion? Any proposed changes to the minutes? Hearing none. Martin, will you call the roll?
Sean King,
Yes.
Deb Poland,
Yes.
Sheldon Taubman.
Abstain, I wasn't there.
Okay, thank you. Leslie Greer and Gisela Carlotta McDonald. Thank you.
I think the motion carries. So we will move on to item D on our agenda is the Broker Academy update, and I will turn the floor over to Tammy.
Yes, good morning, everyone. Happy New Year. Tammy Hendricks, Director of Health Equity and Outreach here at Access Health. It's about that time to start recruitment for the Broker Academy. Really excited to be going into year 4. We've been promoting the program as we usually do at all of our events all year. So there's been a lot of interest in the program, more than previous years, which is exciting. And it's really exciting to see that number grow. So right now, I know there's 91 on the slide, but we're well over 100 leads going into year 4. There's a form that's on the website. People can complete it and add their information, and we'll keep them updated when the application opens and keep them updated throughout the application process. There's been great website traffic, and we also take into consideration the locations of the visitors that come to our website, which plays a part in choosing locations for the class. So numbers are looking really good. We have a really strong list of leads that are interested in applying for year 4. So we're just really looking forward to it. Quick details about year 4 applications. We will open them on March 1st, similar to last year. We can accommodate up to 100 students this year. And this is going to be split between 2 class locations, which we are still deciding on. But I did want to mention, we did get a verbal confirmation from a very close community partner that is willing to let us use their space for the class days, which would be great. So once we get that finalized, we can make that official announcement. They're located in high need areas of the states. They have locations that are very accessible on the bus line. So it'll be easily accessible for our students. We've also added an extra week of the program readiness meetings, which are weekly meetings that we hold for students to prepare them for the actual in-person classes. We've seen how important those weekly meetings are over the previous years, helping the students get prepared for the class. So we added an extra week for that. We also made a slight adjustment to the in-person schedule. This is because we added more structure to the pre-training, the program readiness weeks leading up to the class. So students during that time, they still have access to an instructor. So we did cut the class days down to 2, and it'll be fully focused on reviewing for the exam. So at this point, the students, by the time they come into class, they would have had a month of review and access to an instructor to help them get through the course materials. So now that the class will be on the weekend, there will be less students taking time off during the week as in previous years. And we've actually had we've been getting a lot of good feedback on that. The weekend classes would be more convenient for a lot of students that we've been hearing about. So we're excited to add that this year, making it more convenient for students to take the in-person class on the weekend. Shortly after they take their class, they will go into the state exam. And once they have completed and passed the state exam, we've added a little bit more time for the mentorship portion of the program. So really excited to see us going into year 4. We have a lot of leads going into year 4. We have a lot of new partnerships that are interested in working with us for the program. So it's great to see it grow. And I'll pause here for any questions.
Are there any questions for Tammy? All right, hearing none. Thank you, Tammy. Appreciate the update on that.
Thank you so much. And I'm up next as well. You can't get rid of me yet.
Okay, let's hear the community outreach update. Take it away.
Great, thank you. You know, this year has been a very successful year for Access Health. In general, record-breaking year for us, enrolling over 150,000 consumers, which reflects all of our efforts from all of the departments. We've really been focusing on how do we better reach and engage and educate our consumers, but also our partners throughout the state. From health equity and outreach perspective, it was a busy year for us as well. We had over 174 events that were hosted or attended by our team. Our outreach efforts every year, very targeted. We work really closely with our internal data team. We're always getting feedback from them, but we're also getting feedback from our community partners and our navigators. So our outreach plan's very data-driven, and it heavily relies on feedback from multiple sources, internally and externally. We've done over 300 site visits to our community partners, having conversations with them in person, leaving materials, giving them updates, getting that feedback. Those face-to-face meetings are really important for us to continue to build those relationships. And in turn, they pass on information to the communities that they serve. And they also help us with finding more events, getting access to local spaces that we use for our own events. So it's a mutually beneficial partnership there with our community partners. We've hosted and participated in over 80 virtual presentations. This is a slight decline over from the previous year as we focus on more in-person interactions. Our overall reach, which really it reflects our interactions from all the events that we've hosted over the year. These are the attendees from our fairs, enrollment locations. We have quarterly regional planning meetings that we host for community partners. We also have monthly healthy chats that we do for consumers, and a slew of other meetings that we have with our community partners. So over 5,000 interactions with community partners and consumers. Significant effort for us. We are a mighty team of 5. I know people are always shocked when we say that. So huge win for us. Increasing in-person engagement is always our main goal. Next, we have our Certified Application Counselor program. This program allows other organizations to get their staff certified to be able to enroll consumers. We grew this program by 25% last year for individual CACs to get certified, but also there was a 31% increase in organizations that wanted to participate in the program. So always great to see that number increase. And finally, this past open enrollment, again, very successful for us. We've hosted 24 in-person enrollment fairs. We had 2 locations in East Hartford and Stamford Library locations that were open 5 days a week during normal business hours. And then we supplemented with the fairs, pop-up fairs in different locations after hours and on the weekends. And of course, we had support from our Navigator locations. So as we did last year, we added a lot of resources to the enrollment fairs this year. We had different screenings. We had nutritional education on site. We provided free food, which our navigators helped us get from different food pantries. So it was more than enrollment fairs. We really need to coin it. We need to find a different name for these fairs. There really are resources fairs. We go above and beyond outside providing access to health insurance. And that's a really important part of our mission. And so I will pause there for any questions or feedback. Comments.
Any questions for Tammy? Ms. Chart. I see Deb raising her hand.
Yes, not a question, just some feedback. I just wanted to thank your team for making it easy for our health center staff to get certified every year. The process has gotten better and better. And as far as letting you know when a new staff person is hired and getting that person signed up for the training and having that training occur and all of that. So thank you for making that easy for our folks so that they can then help all the consumers out in the communities.
Yeah, thank you so much, Deb. And obviously, we really appreciate your partnership as always. And your staff in the community health centers, they reach consumers that we can't reach. And so it's mutually beneficial. So we've been working really hard to streamline that process. We know there's a lot of things legally we have to do and paperwork we have to sign, but I'm really happy to hear that feedback from you. Thank you. I appreciate it.
And I'll just reiterate what Deb said. It's great that you can get into all these locations and really reach out to and connect with people and assist with the the enrollment process along with the other activities that take place at the enrollment fairs and the other events. One quick question, and I think I can anticipate the answer to this. I know you probably track how many enrollments are generated from each fair and
Yes.
enrollment locations and things like that. Can you just give us a quick sense of, compared to the overall big picture of enrollments during OE11, how many were generated at these fairs and different places?
I usually, I should have had that number on here and I totally forgot to add that. Sean, I will get back to you. I don't want to underestimate or overestimate the number for you. So I will get back to you with the exact numbers. We do track the enrollments.
It's more of a curiosity. I'm sure that, the tracking is done in a way to maximize effectiveness. I was just kind of curious of what the numbers actually were. So
Yeah, absolutely.
Whenever you
I
get a
will get
chance,
that
thanks,
for
Tim.
you. Yes,
Okay.
absolutely. Thank you.
Any other questions? All right, Tammy's off the hot seat and I'm gonna turn it over next to Catherine with the OE 2025 update.
Thank you, Mr. Chair. Good morning. My name is Katie Hearn. I'm the Associate Director of the EPMO at Access Health Connecticut. I have a brief open enrollment status update for you today. We have the final OE12 numbers to present. We are pleased to report that our qualified health plan retention rate for this OE was approximately 88%. And you'll see in an upcoming slide that our enrollment numbers have increased significantly year over year, aided in part by the continuation of the enhanced subsidies of the Inflation Reduction Act that are set to end at the end of the year. Please note here the projections that Access Health made and shared with the Board of Directors in November. You'll see shortly that our actual total QHP enrollments exceeded the forecast. Next slide, please. Included here are the baseline enrollment numbers for OE12 as of November 1st. So we just wanted to demonstrate how much our enrollments have grown during the most recent OE period. They're here for your reference, and the actual enrollment numbers are on the next slide, please. As noted, our retention of customers year over year has been a key contributor to our record enrollments. In all, 151,151 consumers enrolled in qualified health plans, including Covered Connecticut, as of the end of the open enrollment period. The Covered Connecticut program alone has seen year over year a 50% increase. And finally, our standalone dental plan enrollments exceeded our forecast, and Access Health increased our dental enrollments by 26%. Please let us know if you have any questions about any other enrollment statistics. We'd be happy to get you any more information. Thank you.
Mr. Chairman, real quickly, these are all preliminary results. We are doing a deep dive into all the numbers, and we are creating a final report that will be issued to the board towards the end of February, early March.
Okay.
Again, it'll have more than just, it'll have cost and the performance, and the question you asked about, Tammy, all of that will be included in a much more detailed report. But we want to get these numbers out in front of the board and your committee, so that if you have any questions from anyone, at least you have the information to respond.
Thank you, James. And these numbers look great. I see Sheldon has a question.
Yeah, the question is, Covered Connecticut enrollment is enrollment in a QHP, but then there's
Yes.
wraparound, correct? So
Correct.
why is it not included in the total QHP enrollment, or is it?
It is included. The
Yeah,
151,000.
Katie said that number. Sorry.
The
I'm sorry.
151 is inclusive of the Covered Connecticut enrollment numbers.
Okay.
We just break it out separately so people can see what the total is for that. But as Katie mentioned and James, it's part of the total QHP.
So in other words, there's 100, and just so I understand this, there's 110,000 QHP enrollees who are not in covered Connecticut. Is that correct?
Correct.
Okay. Thank you. Sorry, I didn't understand that.
So I guess it's maybe fair to say that a lot of those outreach efforts that we were just talking about have been pretty effective in getting people enrolled and retained and making sure they have access to all of these plans. So great job.
Yeah, Sean, thank you for pointing that out. If you remember last year, we as Medicare was winding down, the board authorized us to take a certain amount of money out of our reserves to do marketing and outreach as people were coming off Medicaid to make sure there was not any gap in coverage for them. And we presented to the board this last Thursday how we spent our money, the impact that it had. We have a very detailed report about that as well. So to your point, certainly Cover Connecticut, we benefited, and people who are coming off Medicaid who didn't qualify for to get back on Medicaid, even though most of them did qualify to get back on Medicaid, but a number of them, close to 10,000 of them, are now part of Cover Connecticut because of the outreach that we did. The intense outreach, TV, radio, direct, everything was on the table. So that was very helpful to ensure no one had a gap in coverage because they are losing Medicaid.
Yeah, that's great, James, and it's I appreciate how proactive leadership and your staff had been in that regard and getting out ahead of that issue as Medicaid was unwinding and making sure that people didn't fall through the cracks.
Absolutely, and we want to be very careful that acknowledge DSS's role in helping us to make sure no one had a gap in coverage. They were a big part of the outreach communication as well.
Thank you. Any other? Sheldon again. Go ahead.
Yeah, me again. This raises and thanks for that report and some good work there. But this raises the question of what's going to happen as the next huge cut happens, which is to say, the cut in Husky A adult eligibility went into effect last year, except that people have 1 year of transitional medical assistance if they're working, and the vast majority are. So the real cut does not happen. I think, if I'm correct, that it went into effect July 1st of last year. It doesn't really affect folks until July 1st of this year. And I believe it's a huge number. So like you said, 10,000, I think it may be in that territory or larger. What's the plan for working with DSS, again, to try to prevent this group from falling off and not getting into Cover Connecticut if they're eligible?
Yeah, Sheldon, good question. Again, DSS and Access Health, we work collaboratively, continuously with DSS, and everyone that you mentioned, they're all in TMA right now, and we are tracking them on a monthly basis. There's a lot of communication that happens before anyone loses coverage. We know who they are. We know we're doing very targeted outreach through letters, through email, calls if necessary. And Tammy's team are putting together a robust in-person outreach event effort as well, because we know the population that's in Medicaid. We have to go into the communities and be present to help them make sure they get re-enrolled. So we do understand your question is your question is a very good one, but we do have a plan in place. We are working with DSS collaboratively to have continuous communication with those who are about to lose coverage, about to lose Medicaid. That's an ongoing effort on our part as we move forward.
Thank you. And Susan posted that I was wrong. It's the effective date of the cut was October. Yeah. So if that's true, then it's October of this year. It's a little more time. Thank you.
And Just to add, thank you, Sheldon and James, just to add to that, now for any consumer who loses eligibility for Medicaid, the time period for their special enrollment is actually 90 days instead of the 60 days. That was extended like a year or two ago, under one of the HHS rules. So those consumers will also have, obviously, to the point James always makes, we don't want them to have a gap in coverage, but they will have 3 months from the time that their TMA ends to enroll. So it gives them some extra time too, which is always good.
Thank you.
I believe that's
Susan.
Susan.
Susan,
Yep.
Susan, is it you,
Thank
Susan?
you. Yep, this is me. Thank you. I think you were on mute, Sean. So we have a little update for you today. If you go to the next slide, thank you, Marcin, on the changes that you're all hopefully aware of for DACA recipients. So in 2024, the federal government finalized the proposed rule that they had issued a little while back, updating lawful presence status for DACA recipients, which was really great news. It went into effect for November 1st, 2024, and obviously for coverage starting January 1, 2025. So DACA recipients are now eligible to enroll in a QHP and also eligible for financial assistance, federal financial assistance under the ACA, which is great news. Tammy and her team, and also Caroline Ruette and our marketing team, jumped into the outreach for this change, and it took many different forms. The team developed a one-pager that we have available in English and Spanish, and if anyone has any interest, we can also have it translated into any other languages. And then Tammy's team worked on all of their events, as she talks about, sharing this message at outreach events, monthly healthy chats, and also, very importantly, partnering with community organizations in target areas that where we know, or the organizations know, that some of this population resides. We also updated several spots, instances of our website content, so people were aware of this change. And then Marcin, if you go to the next slide. Thank you. Now this is the other update on this area, is that there was a lawsuit filed in 2024. Oh, yes. Challenging this final DACA rule in Kansas. Well, actually, no, sorry, it's filed in North Dakota, but this lawsuit is Kansas versus United States. Several Republican states attorneys general joined in with the plaintiffs, and numerous Democratic states in the District of Columbia, including Connecticut, joined in with the federal government, defending the final rule. So fairly recently, a preliminary injunction and stay was granted in the case, but it only applies to the plaintiff states. So it does not apply here in Connecticut and all of the other 19 plus DC defendant states. So it does not apply in Connecticut at this time. So enrollment continued during open enrollment. We will continue to watch this lawsuit, and also, depending on what happens with the change in the administration in the federal government, how the federal government acts in this case. So we will keep everybody apprised. We'll closely monitor this. Actually, if you go back, Marcin, sorry, I forgot to just give the update on the number of people, thank you, who enrolled in Connecticut. We don't have an extremely large DACA recipient population in our state versus some other states, but we were glad to see we had 117 DACA recipients enroll in a QHP, and of those, nearly all of them, 107, are receiving subsidies. So this is really great news on increasing access to coverage, and we'll just keep monitoring this and keep you up to date on what happens. So I'll pause if there are any questions.
Questions for Susan?
Thank you.
All right, thanks, Susan, for the update. Moving on to our strategic initiatives, and I will turn it over to James at this time.
Good. Good afternoon, all. Just real quick update on we have a number of issues that we're dealing with. Not issues, initiatives that we are managing through. Number one is we have a new call center vendor that we are currently negotiating a contract with, and and then we also we are working on ICRA that John has is given updates to the board. This for small businesses. And then we're looking at 10 clicks. One of our biggest challenges, as Deb is fully aware of, customer service is a challenge for us, and we're still using the same system that was created back in 2012, 2013. And we are working on revamping the entire system so it make it easier and faster, and give new level of make it easier for us to give access to others other than our employees, so that they'll be able to have more elevated access. They could do more for this to support their customers. Right now, our system cannot support anything other than yes or no. So we want to have some flexibility to provide. So again, we are working on the 10 clicks project, and we'll bring it up. We'll bring it up as we move. Keep you updated as we move forward. Those are the three biggest items that we're currently working on. Thank you.
Any questions for James? James, just real quick, I was curious, when do we anticipate the call center contract to be finalized and ready to go?
I think you muted, James.
I don't know if you heard me.
I think you're on mute, James.
Hi, I'm back here. We are currently the vendor that we're negotiating with. We've been back and forth. We're very close. We hope within the next month it'll be done within the next month. But we're very close. We've been going back and forth, guys, for months now, and we're very close for me to sign a contract with them.
Got it. Thank you.
Okay. Thank you.
All right. Seeing no other questions for James? Yeah, go ahead, James.
Okay, no, future agenda items very quickly. We're going to keep you updated on the strategic initiatives, which will have direct impact on our ability to service our customers. And we're also going to be looking to expand the health equity and outreach team, so that they'll be able to service the communities in person even more. So more to come on that as we move forward.
Great. Any other committee members have questions or suggestions for agenda items? Sheldon has his hand raised. Go ahead, Sheldon.
Yeah, I think I'll just suggest that per my question before, that we get an update with including DSS on the effort regarding all the TMA people are going to lose Medicaid, or not all. Some of them will still be qualified for Medicaid, but actually it's good to have DSS there, because then we can hear about what's being done on the DSS side to try to, retain people on Medicaid, and then for those who can't be retained on Medicaid, what's being done on the Access Health side. So I guess that's my suggestion, that an agenda item about dealing with those folks, including presentation by DSS.
So Sheldon, from a process perspective, as you know, we're the front door for all applicants in Connecticut. We don't know if they're going to be QHP or Medicaid until after we've gone through the process. So from that perspective, the communication strategy, the outreach strategy, we're working collaboratively with us and DSS. So I don't know if DSS be able to add anything more than what we will be saying to you in terms of the effort to make sure no one falls through the gap, because it's all on us. It's all on us to do the outreach, to do the outreach, to the mail. I'm sure DSS is doing stuff as well, and we can get that information from them and present it to you. But I don't know if having DSS here is not going to add any more value than what we're gonna present to you.
Well, in past meetings, I appreciate that, but in past meetings, some questions have been asked about what the process was, and we were told, oh, you'd have to ask DSS. And I'm talking about people who are Magi at Medicaid, and that's what these
Right.
people are. So I think it would be helpful. I mean, we meet very rarely, so to have somebody from DSS come to one of these meetings for just a portion of it seems like a very reasonable request. I just don't want to see that problem happen as has happened in the past with this committee, where, no offense, but people from Access Health could not answer the questions about, for example, notices, what's in the notices and how the notices have gone out and things like that.
We'll reach out to DSS, invite them to come in. I
Thank
think the question you asked about the question you were asking about DSS, no, for DSS, they were specifically about DSS, but not the application process. But we
Right,
will invite
it's
them to the
about
next
people-
meeting.
It's about people who are already on and might be losing.
We will invite them.
Thank you.
I'm gonna offer one other idea as well, because there's a similar potential situation unfolding with the loss of the enhanced tax credit. Is there, I imagine there's already some thought given to what kind of outreach is going to be done to kind of, we don't know yet what's going to happen, but we can probably guess. And so I imagine there's been some thought given to outreach efforts to help people who might be benefiting from those, and what they can expect and how they, a plan for reaching out to those folks. Is that something that's been
Yeah,
raised?
Sean, we have a very detailed, robust, aggressive strategy about communicating not just with our current customers, but with the public at large, making them fully aware that the enhanced subsidies are scheduled to end at the end of 2025, and the impact to Connecticut residents. Right. What we have done so far, we have communicated to the board, to elected officials, the governor's office, the impact of the possible end of the enhanced subsidies at the end of 2025, what the impact would be. Our strategy is to communicate with the entire public in the public space what's going to happen if Congress doesn't act. Right, and as we get as we prepare for 2026 OE, and the projection notices go out in October, mid to late October, because we don't know what the rates are going to be for 2026 yet. All right, so we don't know what the impact is going to be. So right now we could do general communication about if Congress doesn't act, at a minimum your premiums will go up by this amount based on current rates. That we've done. We are communicating that to the elected officials, congressional districts. Well, actually, we've broken it down we created for the entire state impact. Then broken it by congressional districts. And we've shared that with our board, as well as with the elected folks who represent Connecticut and DC. And me and my team, we've gone around, talked to the governor's office, leadership at the House and the Senate, so they're fully aware. So our campaign right now is to get the elected officials engaged and make the public aware, so that if this does happen, materialize, they're not blaming elected officials, Access Health, the insurance companies solely for the dramatic increase in premiums.
Right.
And they'll hold people accountable. So that's where we are right now. So we're not going to know what the full impact is going to be until new premiums are created. And we do calculations as we do every year, but we do want to get ahead of it right now.
Okay.
The public is fully in. You're going to be seeing more stuff in the public space about this, but from a generic perspective.
All right, great, thanks. So just in terms of it being a future agenda item, maybe not the next meeting, but somewhere closer to the next open enrollment.
Well, actually, no. We could give you full update on our communication strategy at the next meeting. So we'll
Okay.
add that to the future agenda items.
That'd be great. Yeah, thank you, James. All right, seeing no other hands raised or further comments, I will at this time entertain a motion to adjourn. I think Deb is
So
trying to move.
moved.
Yep, Deb, moved by
Deb.
Deb. Is there a second? I will go ahead and second. Any discussion? Hearing no discussion, Martin, will you call the roll, please?
Chunking,
Yes.
Deb Pollen,
Yes.
Sheldon Taubman,
Yes.
Giselle Carlotta McDonald.
Yes.
And Leslie Greer. Thank you.
All right, thank you, Martin. We are adjourned. Thank you very much, everybody. Good to see you all. I appreciate your
Thanks,
time and your
everyone.
energy today. We'll see you again soon.
Thank you all. Yes, thank you
Have a
all.
good day.
Thanks,
Bye-bye.
everyone.
Thank you.